Hi, kids with autism have a much higher risk of having epilepsy than the general population. So in general population, the risk of epilepsy is 1 to 2%, and in children with autism, the risk is about 30%. So there is a huge risk of epilepsy and increase in incidence of epilepsy in autism. So it is very important to know those information because we want to look carefully at this relation and look how to diagnose epilepsy in children with autism and how to treat it as well. And also it is important to understand that epilepsy by itself increases the risk of autism, and in the general population, the children with epilepsy has much higher risk of developing autism. So there is a connection between those two. And today we'll explore all of those connections so that you have a very good understanding of those connections directly from the epilepsy doctor. So autism is a clinical condition when there is a neurobiological changes in the brain. It's a real condition that happens in the brain connections, and that will result in problems with socio-emotional and communication disorders. So kids with autism will have some issues with communicating with others, eye contact, social interaction, behavioral issues, and other symptoms that will lead also to the diagnosis of autism. And because autism is a neurobiological condition, it is also very common to have other conditions that are sharing the same neurobiological background, such as ADHD, which happens in about half of the children with autism, and intellectual disability and some memory issues, with also happening about half of the time in children with autism. And so as epilepsy, which happens about 30%. It is surprising that autism is not a rare condition. So it happens in 1 in 59 children of school age and kindergarten, so which is a huge number. 1 in 59 is a huge number of kids that have autism, and lots of them go undetected and without knowing that they are having autism, and they just have behavioral issues and no one knows why, and maybe it's autism. Please let me know down in the comments if you notice any signs of seizures in your child with autism, or if your child with epilepsy have autism along with seizures. There are multiple causes of autism, and most of them are genetic causes, means that there is a gene that is responsible for the building of the brain and the neuronal connections, and it will cause autism as a consequence. And no, vaccines do not cause autism, as some conspiracy people think. And the other thing is that some anti-seizure medications, if they were taken during pregnancy, actually can cause autism. And one of the notorious medications for that is Depakote or valproic acid, and that can cause autism in children who were exposed to that in 3 to 5% of the time. So if we have a child with autism, how we can diagnose epilepsy in them. So it is important to identify the subtle changes that can be seizures. So sometimes the child will pause, will have staring spell, will not be communicating or responding to you, and that can be a seizure that is engulfing the brain and is not letting go, so the child will have a seizure, and that can be a sign of epilepsy. So it is important to differentiate between daydreaming and just not paying attention, which happens a lot in children with autism and ADHD, and a seizure. So in daydreaming and just staring, well, the child will look out and then it will not be responsive, usually for a few seconds, and then you can get their attention and they will come back to their normal self right afterwards. And it will be only staring. And in the other case, when there is a seizure, so seizure is an electricity storm that happens in the brain, and at that time the child will pause, will have other symptoms because electricity will spread to other areas of the brain. So the child might have staring along with mouth automatism, like chewing their mouth, and they can turn their head one side or another. They can move their arm, they can pick on themselves, and in some cases it spread bigger, and it can involve the whole body shaking, which can be an obvious seizure. So it is important to look for those subtle changes that can give us a clue that the child is having epilepsy. All right, if we suspect epilepsy and seizures in a child with autism, how can we evaluate that, and what are the tests that we need to do? Of course, genetic testing can be done to evaluate the autism in general, but also there are 2 tests that we can do specifically for seizures and epilepsy. The first one is a brain MRI. So brain MRI looks at the whole brain and looks at the structure of the brain, the build of the brain. Usually the brain looks normal in children with autism, and the problem is microscopic, the connection between the cells. So it will not show up on the whole brain MRI. But when a child has epilepsy, may we see a scar, some connection issues, or some cells did not form correctly, and that can be the cause of seizures. And the other thing is the EEG test. So EEG test is a brainwave test that we can do to diagnose the electrical activity of the brain in children with autism. So we do the test, and usually it's like 30 to minutes to 1 hour, and we can see the epileptic activity that can happen in children with autism. And if we have a descriptive of a seizure and an abnormal EEG, that can lead to the diagnosis of epilepsy, which will guide the treatment. And it's important also to know that we can have epileptic activity in autism without the presence of seizures, and this can also contribute to the changes in the brain and also the language function of children with autism, and that might need treatment specifically for the EEG changes. And if you are worried about if those stirring spells can be seizures or they are just daydreaming or stirring spells, what we do, we can do a long-term EEG or video EEG. Usually this test happens in the hospital. The child will be admitted in the hospital, and we hook them up with EEG and video at the same time, and then we capture their events and decide at that time if there is any electricity excess and electricity and epileptic activity during that event, which will make it a seizure, or it will be a normal EEG during the same event, and that will be non-epileptic or not a seizure, will be a daydreaming or behavioral changes. So the gold standard, the best test is a video EEG to capture the event and make sure it is seizure or not. So now, how we can treat epilepsy in children with autism? It is important to recognize the presence of epilepsy, because treating epilepsy and seizures is essential in the improvement of children with autism. Because if the discharged epileptic activity is so much in the brain, it can even impair their cognitive function and causes regression. So if your child with autism is having regression, it might be due to epileptic activity that is undetected. So the way to treat epilepsy in autism, like any epilepsy case, is with anti-seizure medications, and it is important to choose the right medicine for your child based on the background. And sometimes we can treat epilepsy with any seizure medication, depends on the epilepsy type, and sometimes we can have a specific treatment based on the diagnosis. So if we have tuberous sclerosis that's causing autism and seizure at the same time, we have treatment specifically for tuberous sclerosis. Or if we have a genetic disorder, treating that genetic disorder coming down the brain might help both seizures and epilepsy and autism at the same time. And it is important also to recognize those subtle changes in behavior. So some medication have side effects on behavior in children, such as phenobarbital and also the benzodiazepines and Keppra in some cases. So it is very important to watch for any behavioral changes after starting the children on those medications and discuss with your doctor if there is any. All right, and seizures can present in so many different ways. Seizures, it's not just a grand mal shaking all over. There are many types of seizures and epilepsy types. All of them depends on where the seizures are coming from. And to learn all the types of seizures and how they can be diagnosed, you can see this video that I put all the different seizure types. And stay healthy, and see you in the next one. Salam.